Good morning, everybody. I'm Justine Roberts, a physician assistant at Felicity Day Spa out in Robinson Township. Today we are bringing to you a live AquaGold treatment. This is what AquaGold looks like. It's a vial with a specially selected cocktail. In this case, for this patient, it is botox, Volbella, and some saline. What we're doing today is using this microchanneling device to deliver this cocktail to the patient's skin at the appropriate depth. She's already been prepped up with a laser sin treatment, which means that it kills over 99% of the bacteria on the patient's skin. This is why it's really important, here we go, to have a healthcare provider do these treatments for you. I know that a lot of times they'll sell over-the-counter dermal rolling pens. What we're doing here is actually infusing her skin with a specialized cocktail in a way that will reduce pore size, help with fine lines and wrinkles, and actually give her a better overall appearance of her skin. We use a different thickness solution based upon the area of the skin, and generally speaking, folks tend to look more dewy and their skin looks very, very supple after treatment. You can have this as frequently as every 4 to 6 weeks, even as often as every 3 months, to achieve really nice skin tone and texture. You can see that the depth is a little more shallow than what we typically do with microneedling. Typically microneedling will do 0.5 millimeter to 2.5 millimeters, whether we're looking to reduce scarring or wrinkles. With this, the thickness is about the thickness of a shaft of hair. It's around 0.4 of a millimeter. So this is more of a punch type of system that delivers the solution deep to the skin. You can actually also use PRP, which is platelet-rich plasma. Could you turn your head away so they can take a look? Thanks. And what that does is stimulates the body to produce collagen, in addition to getting the benefits of all this other good stuff that we put in there. Can you think of any other questions that the viewers might have?
Nope. Is there any downtime with this treatment?
Typically not. You know, with microneedling, which is another service that we offer here, you can have a few days of downtime or just even something as simple as what looks like a mild wind burn after treatment. It just depends on the depth. With this, the depth is very predictable at that 0.4 of a millimeter. So what you see is pretty much what you get here. We're actually going to thin the solution out for a second pass on our client here today. But you can just see she's a little red up through here, but all in all, not too bad. These are treatments that I'll actually do to myself before seeing patients or after seeing patients for a day. And most of the time, folks don't even notice. There's really so little downtime associated with it. From this angle with the lighting, you can see that little bit of solution that's right there on the skin surface. That just means that what we want to happen is happening.
Now, I've read that the results can last anywhere from 2 to 4 months. Is that true?
It absolutely is, and it depends on what cocktail you mix. Every single person is different in terms of the amount that they're going to need of each portion. Sometimes, you know, folks will use growth factors. We like to use what is most naturally absorbed into the skin and what's going to give us the most predictable results. I might have a little tenderness under the eye here, but not too bad. You can see this client is doing extremely, extremely well. Is it uncomfortable for you at all?
No.
Okay. Have you had microneedling in the past?
No.
Okay. So, you know, ultimately to give you that nice relaxed look, that nice shiny dewy look, this gives you a really, really easy, maybe 15-minute treatment.
We just had a question come in from one of our viewers that asked what solution is in the vial.
Okay, this is Volbella. It's a product from the Juvederm line of fillers made by Allergan. The reason I like to use, yeah, okay, good deal. I like to use this hyaluronic acid filler because it's very, very thin. It's a member of the Vicross line of technology. Sorry, this is gonna be a little more pinchy under here. It's a member of the Vicross line of technology. It's thin. It's going to absorb into the skin very, very well. In areas like where I'm at right now, perfect timing for the question. These fine lines that people get up through here, a lot of times we'll use injectables like Botox to actually do a lip flip to perk this upper lip up. What this does is makes this tissue a little more relaxed, a little more supple looking, so that when we do something like that, it just works beautifully. Now this client in particular looks great, but even a lot of my friends in their 30s are starting to get those fine lines there. You'll notice whenever you pucker, go ahead, pucker up once for us. These lines that happen whenever folks pucker, sometimes they'll actually be a little bit etched in. So a lot of times we'll actually inject a couple units of Botox strategically in the upper lip that'll flip their lip up just a little bit. It's a beautiful way, if you're not ready to fill it, to actually start using filler, it's a beautiful way to create a really, really pretty look there. Many of my clients are thrilled with their results. Many people are starting to request it now.
Okay, so you have Volbella in there, which is one of Allergan's hyaluronic acid products. What else do you have in there?
I have some Botox and then also saline. The saline acts as a diluent so that we're able to deliver the product most effectively. And just to give you an idea, I've made essentially one pass over the face. We've used a milliliter and a half of solution so far. So I like to do the nose at the end of the first round, and then I always go over a second time just to be sure that we've delivered effectively.
When should she see results from this facial?
A lot of times people
treatment?
will say that they start noticing results as soon as the next morning. You'll notice that whenever you're in your natural light of your, say your bathroom, whenever you're in your normal light that you see every day, you'll notice that your skin looks a little different. I really think it takes a couple weeks to see the full effects of it, but it's one of those things that continues to improve over time. But you can see she has very, very little trauma associated with
Yes.
this. It's a beautiful delivery system. I'm really happy with it. So far, it's really exceeded my expectations. Yep.
So I've read that you can actually do skin rejuvenation on the neck, décolleté,
Yes.
and hands for a more youthful appearance. Is that
Yes.
accurate?
It absolutely is, and this is a great option for the aging neck, particularly if you're in your 30s and 40s and you're starting to notice it, or if you find that you're getting into your 50s or 60s and you're just now, seeing some changes, a little bit of crepiness. This is a great way to really, really hydrate and really, really make sure that you're giving your skin the best attention you can be giving it. There's, to be able to deliver this type of hydration deep, and to be able to deliver these products a little deeper, just a really, really tremendous opportunity for the look of your skin. And what do you think, client? How's it feeling?
It feels fine. It just feels like it's pinching. Nothing.
On a scale of 1 to 10, how would you rate it? 1 being not even feeling anything to 10 being awful.
I would say a 2.
I'll take it. And again, I get this question all the time, so I'd like to address it live here. People always say, well, why can't I just use my dermal roller at home? They do not penetrate to the appropriate depth. They are not going to give you the same results, and they are also not sterile. These are sterile. They come in sterile packaging. We use a new one for every single person who comes in here, and the diluent is mixed to exactly what you need for your skin type and your skin goals. This client and I had a very lengthy discussion prior to doing this treatment today with regard to what she was really looking for out of the treatment. That means a lot, and it really has tremendous effect on her outcome. Tremendous effect. Some trouble areas that I've already identified: the upper lip that a lot of people ask for help with, but the chin. A lot of times people will have that peau d'orange or golf ball look to their chin. She really doesn't, but this is a really, really nice way to kind of plump the tissue there so that it becomes less noticeable. A lot of times we'll do injectables directly into the area to reduce that or release that. That works beautifully as well. But that's a very, very common area. Also the under eye area. One of the tricks to this trade is the light reflex, and a lot of times we can modify that with filler, but sometimes it's as simple as changing the way the light hits because the skin is healthier. So in the grand scheme of things, multimodal approaches are really, really the best way to care for your skin. But this is a great, great part of that. she'll be able to continue her regular skin regimen tomorrow. Because of the way I've cleansed her face, I just like to have her kind of just stay and ruminate in this good stuff for as long as possible.
All right, we just had another question come in from a viewer. The question is, if you want Botox in your forehead to inject in that area, then go over the area with that microneedling tool to penetrate more. Is that how it works? So can you talk to us a little bit about how this does not replace regular Botox and Botox injections? It actually enhances the result that you get from your regular injection areas. And what would you do, you know, if someone was due for their injections? Could you do this and then do the regular injection and then do the AquaGold after?
Absolutely. Absolutely. I love that question. Thank you. I'm going to set this down for a minute. I absolutely love that question because it's a great treatment to have actually along with your Botox treatment. Reason being, Botox works in different ways in different tissue. I'm an expert injector. I like to inject at depths that are meaningful to what the patient's actually looking for. So you have to get down to the muscle in order to reduce dynamic wrinkles. So it's really important to identify the appropriate musculature for what we're going for, and then go to those appropriate depths. So the corrugator muscles that we work on for the 11s. Will you scrunch your forehead for me? Good. So she has been Botoxed, so these 11s aren't possible because her corrugators are paralyzed. So we actually shoot down into the corrugator muscles in order to achieve that. By putting this 0.4 millimeters into the skin, you'd never get down to the appropriate depth to reduce muscle movement there. The procerus muscle here, up and down, the nasalis, the ones that make these scrunches this way, the up and down muscles, they're also a little bit deeper. On the contrary, whenever you work out here in the crow's feet area, I like to perform intradermal injections there, which are a little bit closer to the skin surface, meaning the muscles close to the skin surface. Still with this AquaGold device, you're not going to get deep enough to really affect those muscles in a meaningful way. This is more just to relax the skin out. Whenever we're working for hyperhidrosis, though, the overactive sweating, which lots of people have, whether it be underarm, under the breasts, on the forehead. I'm a distance runner, and I notice whenever I have Botox in, I don't sweat as much. She'll notice that she doesn't sweat as much, too, because we're putting this in the skin itself, which is where the sweat glands live. So very, very important. The thing to remember, too, since we're not using this in actual muscle, we're using this in the skin, it's going to make you sweat less. That's just the way it works. If we were to inject her underarm for that hyperhidrosis, it would last 6 to 9 months because we're using it in the skin. We're not using it in a muscle that's going to work to wear it off. So it's a really neat concept. I'll tell you what, I really like to inject my own clients who are having this type of work done just to make sure that they're getting the appropriate dosages. It's really, really hard to overdose on Botox. You need quite a few vials to do that. So I'm not worried about that so much as just strategic placement and to ensure safe and effective So treatment.
Because you're getting the Botox and the juvederm or whatever hyaluronic acid products that's being used, it's penetrating into a different depth. You're getting different results.
Yeah.
So you don't have to worry about, you know what I mean, like the droopy and all that stuff going close to the eyes because it's not going into the muscle, correct?
Absolutely. And, this is a really, really great first step. If you've never had Botox or fillers before, but you really want to rejuvenate your skin nicely, this is a really, really nice first step. Any other questions, please feel free to shoot us a message. Yeah, please give us a call up at your convenience to schedule a consultation. We'd love to take a look and give you an idea of what concoction we'd love to use on your skin.
All right.
Happy Sunday.
Sunday fun day.